Good afternoon, and today I have a pleasure of interviewing Dr. Biju Krishnan. He joined us from London. Good afternoon, doctor.
Good afternoon, Maria. Delighted to have you on me. I'm delighted to be here.
And thank you very much to our audience. If you have trouble sleeping or sleep next to snoring partner, this program is going to be for you. We're going to try to evoke the curiosity, how treatment can be approached from different angles, and this time from angle of dentofacial growth and function. And if you're medical practitioners who, just like us, trying to put all puzzles of sleep disorder briefing together, this program is going to be for you, because we're going to talk about expansion or dentofacial growth for adults, as well as the treatment for temporomandibular joint. And as usual, to introduce my guest, I'm not going to read the bio. I'm just going to tell the personal story. What I met with Dr. Krishnan on a conference, like viewing conference where I present in September in London. Day before that, it was the conference of dentofacial growth and function, where the specialists from United States and Europe got together and discussed different strategies on treatment of sleep apnea or sleep disorder breathing, treatment of temporomandibular joint, and of course, orthodontics and orthopaedics. And it was actually, thank you to Dr. Krishnan, who put this conference together, and actually he brought bright minds together to help all of us with that very interesting treatment strategy. And my personal approach, because I'm trying to explore different views on treatment in my channel, as well as in my practice, question of growth or changing something in a function or in a structure for adults was exciting topic for me for many years. And I interviewed Dr. Belfer and everything related to his school of thought. I have a lot of physical therapists on my channel, as well as behavioral optometrists. So I'm trying to approach this problem from different angles, as well as my functional therapy is very close to my heart. And my first question to you, Dr. Krishnan, please tell us, is that true? How, from biological standpoint, we can actually have slow palatal expansion for adults? Because if we have a bigger jaw, like reverse our evolutionary situation, maybe we can have more people sleeping well at night and breathing well at night, which is of course related.
Well, yeah, it's a great question to start with, and I think it's quite often misunderstood, even within the profession. Okay, so I mean, you're absolutely right. I mean, adult bone isn't like a child's bone. It's not as plastic, but it's a mistake to think that it's fixed or it can't change shape. Okay, so when we talk about expansion in adults, I mean, there's two ways to do it. You can just crank it open and force a change, but you can actually develop, especially the maxilla, you can develop that using light and slow forces as well. And I think it's important to understand the kind of bone that we're talking about, okay? Because when we talk about, especially the bone in the face, it's a different, there are different types of bone. The bone that I think most people are aware of is something called chondral bone. Okay, so chondral bone is the bones of the long bones, the legs and stuff, and it's more genetically programmed. But with the bones in the face, we're talking about something called dermal bone or membranous bone. So dermal bone develops slightly differently. It's from connective tissue. It doesn't develop from the cartilage. So the way that the dermal bone grows, it doesn't have a memory. It relies on function, on forces that are applied to it. Okay, so It's the growth and the remodeling are far more dependent on this functional stimuli to develop the face. So it's especially muscular force, tongue pressure, breathing patterns, or the biting forces. And that functional response doesn't disappear at the age of 18. Okay, so dermal bone, it can reshape, it retains its capacity to respond to mechanical and functional input throughout life, which is why slow palatal expansion can still create meaningful change in adults. Okay, we're not trying to split the suture in the classical sense. We're trying to gently encourage bone remodeling along the palate, and even in the floor of the nose. Okay, and I suppose one important theory to bring in here is something called the functional matrix theory, which I think you're familiar with.
Yeah, I love what you brought it up. I really want to mention that. Can you share what's exactly matrix theory? How is it happen?
Yeah, so functional, this is something very important to understand. Dermal bone, what we talked about, is the big part of the face. It doesn't grow according to like a blueprint. Okay, it adapts depending on the functional demands that we place upon it. So let's move away from the face. Let's take a look at something bigger. Let's look at the rib cage. Okay, now the rib cage grows around the lungs. If the lungs are underdeveloped or they don't fully inflate early in life, what happens to the rib cage? The rib cage becomes narrower, more vertical, doesn't expand as much. Why? Because the function inside wasn't strong enough to shape it. So if we come back to the jaws, well, what do you think is the most predominant functional matrix that develops the jaws?
The chewing, we can say breathing as well.
The biggest thing is the tongue, right? The tongue is the organ of form for the maxilla. Okay, so again, because the maxilla is made of dermal bone, it remodels in response to the functional forces. It's not cartilage that drives the growth. And the tongue is it's the driving force for the face. Okay, the upward force it exerts on the palate, widens the palate, lowers the roof of the palate. The sideways pressure expands the palate. It can allow the face to grow forward. Okay, so the tongue provides this 360-degree gentle continuous force. Okay, so if the tongue rests on the palate, the maxilla grows wide forward and it's stable. If the tongue is low, then the maxilla collapses upwards, it becomes narrow, and it drifts backwards. So that's the functional matrix theory. The bone doesn't have memory. It's really, this dermal bone is really driven by the soft functions within and around it. Does that make sense?
Totally makes sense for me, because I do believe in myofunctional therapy, and we use the principles of myofunctional therapy all the time. But I want to ask you, I know you said 20 different appliances. What's your primal principle of selection of the appliances? Like we talk on my channel about ALF. We have Dr. Torzo on the channel. We talk about Homeoblock. I know you use those tools. And I have a lot of orthodontists on my channel. We talk about different appliances. Tell me what principles you use. Yes, you mentioned it's wonderful. You want to create the function of the tongue with those appliances. Yes, they can be applied, but what's your view on the selection of the appliances?
Excellent question. So you mentioned, lots of different appliances that I've been doing this for 30 years. And in that time, I've used many different appliances. And what I think is the most important thing is I don't really get hung up on appliances. Okay, for me, the appliance is not, to be honest with you, it's not really all that important in the first instance. What's way more important to me is, where is the patient at? Okay, what do they present with? And where do they need to get to? Now, some people use a blue thing, some people use a red thing, some people use a yellow sparkly thing. And guess what? If you know what you're doing, the results tend to be quite comparable. This is the most important thing. It's not the device as much as the person behind the device. Okay, and what I do object quite strongly to are people and companies, especially companies who have one thing.
Yes, yes, yes. We know those companies very well.
And and then they try to retrofit every problem to that one device. Okay, so this just doesn't work. Appliance selection for adults is an exercise in matching the tool to the anatomy, the functional pattern, the patient's nervous system. So you need to be experienced in multiple treatment modalities. If someone has a significant cranial asymmetry or a TMJ problem, or is neurologically sensitive, that would be different for someone who doesn't present with those symptoms. Okay, so for many patients, devices like the Homeoblock, BioBlock, Schwartz, Williams, RN Sagittal, Crozat, Hyrax, there's so many, right? Even aligners, which I don't particularly like. They can all be very powerful in the right circumstances, but they all come with their pros and cons. There is no perfect device. Okay? And believe me, there are almost as many devices as there are orthopedic orthodontists. I think everybody has to develop their own device. Okay?
No, that's beautiful too. But I have a question for people who have who are very neurologically, you said, very sensitive. You recommend ALF, right? You recommend that appliance can have a calming effect on the nervous system.
Absolutely. So the ALF approach is very different. Okay, and it took me a long time to understand why the ALF is different. So for those of you who don't know what an ALF is a very thin light wire appliance. ALF stands for Advanced Light Wire Functional Appliance. And the first thing you need to understand about the ALF, and actually it's a really difficult thing to understand, okay, is the ALF is not an orthodontic expander. Okay?
Yes, that's difficult to understand. And
it's very difficult. No, it took me over 10 years to figure that out. Okay. And when the penny dropped, it dropped big time. Okay. The ALF was born in the womb of osteopathy. Okay. So what the ALF does is it doesn't directly expand anything. So the biggest mistake that most dentists or orthodontists do when they use an ALF is they use it as an expander. They use it to exert a force on the palate or on the teeth in the hope that it will do what a conventional expander does and expand. But that's not how an ALF appliance works. What the ALF appliance does, you've got to think of it from an osteopathic perspective, a holistic perspective. What we're trying to do with the ALF is we're trying to get the whole craniofacial structure moving better. Okay? Because very often when you have narrow palates, when you have jaws that are misaligned or too set back, this is as a result of something else. And that something else is usually from birth. Okay? There are cranial restrictions, there are asymmetries, there are the whole skull, the whole craniofacial complex is just not moving very well. And when you work with an osteopath, the osteopath will try and regain this cranial motion. Every time we breathe, our skull does this. I mean, this is exaggeration. It's very, very gentle. It's very subtle, but it moves. Okay, and if that movement is restricted in any way, that has an impact in the way our face develops. Now, what we're trying to do with an ALF is we're trying to regain that motion within the whole skull. And by using an ALF appliance, it really helps the cranial osteopaths work in getting more symmetry, in getting more balance within the cranial system. And when they work in the way that they do, and it's a very skilled, very expertise, it's very hard discipline to find someone who's good at it. But when they start doing what they do is they're removing restrictions within the craniofacial complex. And by removing those restrictions, the ALF then allows the jaws to develop naturally into their more optimal position. And again, that really then relies on this functional matrix theory. It relies on the tongue being in the roof of the mouth, allowing that change to happen. Okay, so it's the actual development of the jaws is secondary to getting everything else working. So I think the biggest frustration for a lot of dentists or orthodontists who use ALFs is it can be a slow process because it all depends on how much restrictions there are elsewhere within the body. But when the ALF does work, it works absolutely beautifully. Okay, it really helps balance the whole not just the craniofacial system, but we've seen it balancing the whole body. It really provides that foundation in which you can then build upon. A lot of people who do cranial work without having enough, yes, you'll get some benefit, but the bite tends to take you back to square one. What the ALF does, it sort of helps. It sort of strengthens the work of the cranial osteopath and the body worker and the myofunctional therapist. You know, it all comes together. It's quite a complex. It's not easy to get your head around it. There's a wonderful book by one of my mentors, Tasha Turzo.
Yes, Tasha Turzo. We interview.
And,
yeah.
I'm blessed to be able to work with Tasha and see her at least once a year in her place in Malibu. So yeah, she does some wonderful work, and Derek Nordstrom obviously developed the ALF. It's a difficult thing to get your head around. Once you do understand it, it's a very, very powerful tool.
Yeah, no, that's almost like a voodoo magic. You know, that's a beautiful thing, absolutely. But a lot of people want to see the results, and that's become, you know, that's an interesting approach also. You know, that like yes, we have to have a lot of tools in a box, and probably the ALF appliance is your go-to appliance in case of temporomandibular joint disorders.
Yes and no, it depends. Again, temporomandibular disorder is such a wide encompassing term. Okay, there are so many reasons why people would present with a temporomandibular joint disorder, and it's not necessarily because of the joint.
No. Joint is it's like it's a balancing tool. That's at least how I look at that. You know, people trying to find the balance with the teeth if everything else is unbalanced. So if you can illuminate that area of your practice of working with people who suffer from temporomandibular joint disorders.
Yeah. So again, it goes back to well, understanding what the problem is in the first place. You know, this is the critical bit about, especially with TMJ. You know, there's a saying amongst TMD dentists, it's very easy to find TMD patients, but it's really hard to get rid of them. Okay, and the reason is people don't understand what it is they're treating. Okay, they tend to have one device or one splint that sort of works for everyone until it doesn't, and then you think to yourself, well, what do I do next? So the most important thing is really understanding, well, why does this patient have a TMJ dysfunction?
You have to be a good Sherlock Holmes.
Sorry?
You have to be a really skillful detective, Sherlock Holmes.
And this is even more complex than anything else, right? Because there are so many factors that affect the dysfunction of a joint. Okay, and I think the occlusion, the bite, is probably one of the least things one of the last things I would look at, right? That's a symptom of something else. But you know, to understand why the joint is where it is, why the disc is where it is or where it isn't, what's caused that problem in the first place. Because quite often, you know, we see a lot of patients with TMD, and the problem isn't anything to do with the joint. It's referred pain from somewhere else. It's other structural problems. It's a whole myriad of things that are not naturally associated with the dentition. Okay, so you really need, so the diagnosis of TMD is absolutely critical. Now, assuming that, of course, there is a derangement of the disc, then the first thing I would do is get an MRI scan to understand, well, exactly what is happening with that disc, what is happening with the joint, what is happening with that joint in motion. You know, what are we seeing? How much damage has already taken place? And then you use the appliance that works best for that. And maybe it is doing a bit of arch expansion. Maybe you need to use an ALF. Maybe you need to go slowly. Maybe you can go a little bit with a rigid expander. Once you get the jaws in the correct position, once the mandible is balanced, maybe you need a splint first. Maybe if it's an acute phase, maybe you need to solve that problem. Maybe there's a myofunctional component. Maybe the tongue isn't in the correct position. Maybe the swallowing is incorrect. You see, the dynamics there's so many variables when it comes to DMD. So it's the same thing I say to dentists when they start to approach orthopedic orthodontics. Forget about the tool, right? Most of your time needs to be in understanding, well, what is the problem? Why is this patient, why is this patient where they are? What has led them to this place? understand that, and that's a difficult bit. That can take a long time to understand that, and then devise a treatment to deal with that problem. Okay, don't just have one splint and say, I give everyone a splint, and it sort of works. It may work, but quite often it works for the wrong reason.
What the reason? They just disocclude and kind of reduce the load.
Well, yeah, and that's temporary, and sometimes that's all patients need in the short term. But we're trying not to manage TMD. We're trying to cure TMD, right? And so to cure TMD, you need to understand what is the cause of it, and that's very complex.
Yeah, no, that's why people need specialists like you are in the society what you create, and I highly recommend to my audience to check your website. We're gonna put it underneath the interview, and for professionals who listen to us, I recommend you to join the Society of Dentofacial Growth and Growth and Function.
Yeah, and one thing I can just pick up on that is exactly what you said. This is not just me. I never manage TMD on my own. It is at least 3 or 4 different individuals that are involved in this process.
Can you share a little bit of that? Can you share the collaborative approach? How what's your go-to people? What specialty you get, involved?
So this comes back to the society that we formed, the Society for Dentofacial Growth and Function. So what we realized at the time is when I started doing this is that my view of this is very narrow. We need a more multidisciplinary approach. When orthodontists work in isolation, we tend to move teeth. Maybe we can even move bone, but the relapse risk goes up. The temporomandibular or muscular symptoms are more likely to be more common, and we often miss the opportunity to improve patients' overall function and well-being. Not just their bite. So then we started to collaborate with other professionals. One of the 2 professionals we started to bring into my team were myofunctional therapists and osteopaths. Okay, but when I take a multidisciplinary approach, I'm not being sort of alternative, right? This is the other thing. I'm simply recognizing that the craniofacial system is connected to everything around it. Who would have thought, right? The body, all the systems are connected. So we need to adopt a very multidisciplinary approach. And so that you look at the people that are in my team now, myofunctional therapists are important. And for those of you who don't know what a myofunctional therapist is, it's about function, primarily the muscles of the tongue and the muscles that surround the mouth, and swallowing and breathing. So this is all about the functions of the face. Cranial osteopaths, we talked about how cranial osteopaths are critical in establishing good cranial motion, removing restrictions that are inherent probably from birth. ENT surgeons, airway specialists, these are essential because no amount of orthodontics or orthopaedic orthodontics can compensate for a child who simply cannot breathe through their nose due to anatomical obstruction or chronic inflammation. And then you have breathwork practitioners or respiratory physiologists who help rehabilitate dysfunctional breathing patterns. One of the big things, Maria, this, most of us don't breathe properly.
I cannot stop being amazed how often me as a dental sleep medicine specialist who see adults come to that problem. I would say 99% of the time.
Totally right. So it's all very well us as orthopedic orthodontists creating these nice big airways. That's only half the thing. The patient actually has to know how to use that airway. So what I say, it's not about a big airway, it's about how functional is that airway. Because you can have smaller airways and it can still be very functional. Okay, so it's very important that we bring in breathwork practitioners to help patients understand the importance of diaphragmatic breathing.
Yes.
It doesn't come naturally, right? The natural thing is to breathe hard, to breathe through our mouth, to fill our lungs up. It doesn't, but that's counterintuitive. Proper breath work is something most people have to be taught.
This
You know?
is I would say evolutionary and revolutionary in the same time. And I can't, when I got into this area, I can't just be amazed what stage of evolution we are in and what destiny can wait for us if we're not going to start acting. And that's what I put in my book. I try to put it through the personal stories, through stories of people who are going through that difficult journey. But that's all come to sleep and breathing and size. And I like how you mentioned about the bone. And for my audience, if you want to know more, please join this wonderful society. And we hope to bring the work, internationally, and bring the specialists who practice this modern, anti-evolutionary science, like reverse the evolution science to patients. So thank you very much.
You say it's modern. You say it's modern, but this is how we used to do it. You go back 100 years, we weren't talking about teeth. We were talking about facial growth. We were talking about functional appliances. So
function, form and function, absolutely.
This is a reinvention of something we've known for over 100 years, right?
Yes, no, but it's like new is very well forgotten old. At least we have that saying. So it's true. And matrix theory, what you brought up, it's been, described more than 100 years now.
Exactly.
So that's like a very well forgotten knowledge. And we know what a form follow the function, and that's what exactly you're doing. You follow, very common principles, form and function.
Yeah, we're just trying to help nature just get itself back on track. We're just trying to remove the restrictions and allow the growth to be more normal. And that starts pretty much from birth, and some would say even before birth.
Yes.
So, people like lactation consultants are very important, teaching mothers how to breastfeed, the importance of breastfeeding, because this is what develops the face, the function. And if a child is functioning well from day one, then the chances of having problems later on are diminished. Okay, so there's such a huge number of people. I've mentioned a few already. We have nutritionists, chiropractors, pediatricians, allergists, psychologists. So there's a whole bunch of us involved that need to be involved in the early stages, so we don't get to adults who have TMD. We don't get to adults who can't sleep, and snore and have these huge problems.
Thank you very much. We appreciate your time.
No, it's lovely to be here, and thanks for having me.